Good evening, everybody. I think I am live now. So, good evening to everybody. Warm wishes wherever you are listening to me. My name is Dr. Ashish, and I specialize in natural fertility or using natural therapies, natural medicine, herbs to enhance your fertility while you're going through natural conception or that you are going through IVF and you would like to have a better chance at IVF. So right now I'm trying going live, and not trying, but I am going live on in the group that I have, Fertility Conceive Naturally. I am also going live on my profile on Facebook, and also I am live right now on Instagram. And this will go out as a podcast afterwards as well. So it's too many places that I am just giving it an attempt. So thank you for watching and for engaging. If you have any questions, feel free to ask. If you have any experiences to share, do share with me. I would love to hear from you. Hi, hello, Mr. Ramshankar. So this live is, and all my lives are very, very specific to do with fertility. So these are not about general health, but more about natural health with fertility, how to conceive better and everything fertility wise from a natural point of view. So today's live is about IVF, which is in vitro fertilization. As we know, we also know it as test tube baby. Because that's where babies are conceived in this case. And what is my perspective on it overall? What happens through the whole process of IVF? Half an hour is not enough, and I will not be able to cover maybe not even one aspect of it. Perhaps when we do live on Sunday, I'll cover a bit more. I will also talk about how I support my clients, my couples who are going through IVF, and I work with them and helping them to conceive better. So IVF as I see it, and also so let's just have a chat. What is my perspective and what I think about it. So I am somebody who had IVF myself. I have twins from IVF, a boy and a girl. They are 13 now. And you know what happened during that cycle and what I saw and how now what is happening with IVF cycles at present. So I want to talk not specifically about the medical process of IVF, but what happens when you are chosen to have IVF, or you choose yourself to do an IVF if you're on a fertility journey. And then what happens before you get to that point, during the actual process of IVF, and then when that particular cycle finishes, and what happens afterwards. So that is my attempt here to give my viewpoint. So I am a practitioner of natural medicine, an Ayurvedic practitioner, also called Vaidyas, and I am a medical herbalist and a trained yoga practitioner, and also an NLP practitioner. However, I am more of an integrated medical practitioner. I do have a viewpoint that we can combine all the medicines together to give the better health for people, because that's what it's all about. When you are sick, you don't really care where the health comes from or how do you get better, as long as you get better. However, with natural medicine, with natural herbs, therapies, a lot of natural paradigms that we use, we preserve health much better. And that is my goal, even with the fertility work that I do, is how to preserve the health of couples, of women who are going through number of procedures to do with fertility, trying to have a baby, trying naturally, or they are going through IVF, and what happens with them, and how can I make that process better for them? How can we have a better outcome? How can we have a baby without destroying their health? So, yeah, I was talking about my IVF cycle, which was now 14 years ago because my twins are 13 years old. And this is something which, before I had IVF, I had ectopic pregnancy, which was the same year in 2007. And following that, I conceived around August time, 2007. So my twins were born in April 2008. And this is, the actual process. So what happened that we decided that we want to go for IVF and looked at the best clinics in the country. And the clinic that we had near us was Holly House, which is in East London. And this clinic at that time was if I'm not wrong, number 5 in the list from top. And being closest was easier to do because distance also matters, how far you have to go. At that time, I probably didn't realize the number of appointments and, before I started. But now I know for sure distance makes us much better. If it is closer to you, then it is much better to go to appointments and all of that. And we thought, okay, we want to give a trial. We want to try IVF. And my point, being an Ayurvedic practitioner, being a natural medicine practitioner, was that IVF is invasive, and I didn't initially want to go through IVF. And then I also thought that maybe this is how my path is to have a baby or babies in this case. And that if I am going to go down this path, I will give it one trial. I will go and do IVF once. So that was the mindset. That's what I thought when I initially started it. And thought of it, selected the clinic, made initial, inquiries at the clinic, and then made an appointment to go and see the main clinic, the practitioner. I do not remember doctor's name now, but the main head of the clinic, we went and saw him. And straight away, because we wanted to start the procedure straight away. And, here we go. They asked us to come back and explain the whole process, how it's going to work out, how the sperm samples are going to be collected, and how you have to provide sperm samples, and, what is going to happen with the collecting of the eggs and the whole thing. So the moment we kind of found out about the clinics, to the point of making an appointment was timescale wise, I don't think it was even more than a month or 2 months at the most. And we went there and from the point we had the consultation there with the IVF clinic to the point of me being pregnant was about 3 to 4 weeks. Yeah. So it was just literally that quick. And I also remember, if I remember correctly, with all the documents that they give you and, advice that they give you, there was no dietary, there was no nutritional advice that was given or not even suggested. I think there was counseling or counselor, his name was mentioned on the notes, if I do remember correctly, and that was it. But it was not highlighted enough, or it was not mentioned enough that you must go and see somebody, or that we recommend that you go and see somebody. It was just part of their notes that they gave us, and that was it. And then what happens is, the moment I was pregnant, I was discharged from the IVF clinic. And then you are under your GP's care, or whoever you choose, if you wish to choose private care or private gynecologist for yourself. And I know, from my own experience, and I know from my patients' experiences, that point when you are discharged, which is very early on, you have just got pregnant. And we know that many a times women do miscarry after that point, that initial point where you got pregnant. There may be an initial scan as well, which it was in my case, early pregnancy scan, and then they discharged me. And that happens with other patients as well, I know. And I know that patients have mentioned that point where they feel almost lost, because or feel that this is it's cruel to be just leaving patients like that. So it was for me as well. I also do recognize the fact that I'm a practitioner myself. So many of the things that happen in clinics or with doctors, I'm very familiar with the whole scenario, and I'm not as apprehensive going into a clinic or into a hospital. And I do realize that because when I see patients and when I see clients and when they are going into these procedures, and then they are on their own to navigate their path further down the road of IVF, it's like it is overwhelming and scary. So that's what happened with me. And you know that's what happens with the process of IVF. And I'm also going to talk about when it does not happen, it does not end up in pregnancy, what happens then. Yeah. So in my case, there was pregnancy, and then went to GP, and the whole process, and it was all fine, going through the whole process, and had full term pregnancy, that up to 37 weeks with the twins. So what happens with other people who are going through IVF, to the point where they have been suggested IVF by their gynecologists, by their GPs, doctors, to the point of actually making first appointment in IVF. Now, we also know that throughout the UK, there is IVF Lottery System, which means that not every borough offers the same number of IVF cycles. The age limit is different for everyone. Even the fact that there may be homosexual couples, they have to go through some more tests, and they also there is a tax which they have to pay. So it is different from borough to borough, from council to council. So you may not be suggested in one council, you may be given one IVF cycle, whereas compared to another council where you're given more than one IVF cycle, depending on your age. So there is a huge disparity. And that is why it really is like playing a mind game, because you don't know what is going to be your lottery, what is going to fall in your lap, and how you're going to end up having how many cycles on NHS. And if it is not on NHS, then it is you have to fund them privately. So from the point of first thinking about maybe that you will have to go through IVF, to the point of actually going and seeing the first consultation, it could be months in between. We know that now for sure, since the COVID has happened, that waiting list is huge, and in many cases there is still huge waiting list for couples to get on that IVF. Also, that if you were in that age bracket where your borough had a cutoff point, or your council had a cutoff point, then you already lost that perhaps that chance of having a NHS funded IVF. And within NHS also, there are different funding systems as well. Sometimes you can pay for the second cycle, 50% of it you can fund yourself, and they pay 50%. So there are a number of variations, and you have to understand all of them. You have to understand how your council is working, and to realize which can add another extra pressure, or another layer of pressure to you, because there is already pressure. You already are on that journey where pregnancy is not happening. You're not able to conceive yet. And on top of that, you also have to mind that maybe you're getting late in terms of council's cutoff point. So That could be weeks and months, and by the time you actually get to the cycle, actually get to start the IVF process. And then the IVF process itself, generally is one cycle where your eggs are going to be collected in women's case, and fresh sample of sperms are also collected in that cycle. And that means in that particular cycle, you will be given a number of drugs which you have to start beforehand and keep taking them until they collect your sample. And if it is a cycle where you are doing fresh embryo transfer, that it's a cycle they've collected the eggs, and then eggs and sperms are, uh, you know, they are being fertilized in a tube, and then put back in, the embryo is put back into the uterus. That is called fresh embryo transfer. And if that is happening in that particular one cycle, then it is a process not more than a month and a half. Many a times, if when they're looking at collecting the eggs and the number of eggs is not enough, and you might have to then go through another cycle of stimulation where they want to collect more eggs, because even with all the drugs, even with all the injections, the number of eggs may not be enough depending on the age and depending on many other factors. So it's not just that one cycle that you're taking all the drugs that you're taking, there may be another cycle, or there may be other issue that can happen. One of the things that happen in IVF cycle is the drugs that are given can cause the hyperstimulation of the ovaries. And if that happens, again, that has to be managed and monitored, which means that you may not be able to have the fresh embryo transfer, perhaps that cycle, and you have to then wait for it to calm down. So this is, um, you know, sorry. Yeah. So this is, sorry, there was a question, got distracted. So this is very, very, obviously very technical, and only perhaps those understand who are going through IVF, because I do support a lot of couples who are going through IVF right now, and what happens, so they will probably understand this a bit more. So that can prolong things. So it's not always as straightforward as it may seem. So what happens when you're going through the drugs which you're taking every day, and it's not just one box, two box, it's a number of boxes, that now there are so many different medications. There are many more medications, I think, than when I did it, which was now 14 years ago. So what happens when then there you do get to that point when there is transfer? Yeah. If it is not fresh embryo transfer, it will be frozen embryo transfer. And you get to that point of transfer, which could be not straight away, which could be few months down the line. So in between, you're waiting for your body to calm down, or you're waiting for other test results to come back, and then you are going through the transfer. So what can happen once you have had the transfer? So when you have the transfer, there is 2 weeks of waiting period, more or less, before you can test whether you're pregnant or not. And that waiting period, the more I hear from patients and clients and discussions, it is very, very, very hard and difficult and stressful time, where you are constantly thinking about whether you're pregnant, whether you're not. And also that you might, the urge to test yourself, that, shall I test today, 5 days, 6 days, 7 days? And I know that many women then test, because it is just so uncontrollable urge to find out. Many a times you may start to feel the symptoms, and many a times you don't feel any symptom. But whatever is happening in your body at that time, any twinge, any little thing that happens, you're going to be thinking, every possibility, and generally we think quite negative things about, oh, okay, so this is not happening, oh, this is a failed cycle, oh, that we are not pregnant, oh, I'm going to miscarry, all sorts of thoughts that go on in that 2 weeks. That's probably the 2 longest weeks that I hear from couples. Hi. The question is, major issues generally couples faced after or during IVF is emotional stress. Absolutely, yeah. Emotional stress is there from the start, especially when couples do get to the point of IVF, which means they have been trying for a while. And it hasn't happened naturally. It hasn't happened through IUI. It hasn't happened through Clomid. It hasn't happened through any other method they have used. And now they have come to the point where they have been suggested, or they chose themselves to go for IVF. There is already that emotional stress is built up. And that is a huge amount of stress, which we underestimate, and we don't think about it, and we sometimes brush under the carpet. That, especially if couple then is successful in being pregnant, they may not think about that emotional stress and just brush it under the carpet. But that stress that built up does not go away even when you do have the baby. So you are right, Ankit. So where was I? I was talking about when you are waiting for those 2 weeks to find out whether you're pregnant or not. And then when you do actually test it, so obviously two possibilities. One is that you do get pregnant, test is positive, and then the whole scenario changes. You start from there onwards thinking about the whole pregnancy and everything positive about it. The other scenario is if the test is negative, and then to realize that your IVF cycle has not worked this time, or it has failed this time. So what happens going further down that route? Yeah. So emotional stress, as is already mentioned in the question here, is already there. Also, the whole hype, the whole looking forward to being pregnant, and then the disappointment of not being pregnant. And then I think one of the things that happen to all of us when something doesn't work, we are looking for answers why it did not work. Yeah. And we are going through every single test, any diagnostic test, anything that is possible that we can test with the eggs, with the sperms, with the embryos, with our health, with the uterus, that is available there for now for us to test. We test all of that when a cycle does not work. So, and the time scale that we have, right? So 2 weeks you're waiting. And then if you find out you're pregnant, that's a different route. Then you are discharged from IVF clinic, and then you go to your doctor and you start that journey there, and you go to midwife, and that's a different path. And when the IVF does not work, and the success rate of IVF, the max with everything best possible, and still there is no guarantee of IVF working, even with everything done to the best, is at the most around, say, 32, 35%. Yeah, which means that in over 70% of people, the chances are that first time it is not going to work. And then starts the whole thing about analyzing. And of course, the emotional roller coaster ride that happens with that. I've spoken about stress and chronic stress in my previous lives as well. And here we are talking about I'm particularly talking about the time scale of the things, the actual practical process of IVF. And so when you then check or testing yourself, so that is not that all the tests are done in one day. You may be going through test after test for next few weeks. Yeah. And also that you are realizing that this IVF cycle hasn't worked, then what next? Whether there is another IVF cycle, or that this was the only IVF cycle you're going to get on NHS, and what next? Now we have to fund this IVF cycle, and we didn't even think about it, or we did think about it, but we don't know where now to start because this hasn't worked. That means, and obviously, most of the couples, when you're in that position where you've tried something, it hasn't worked, you're thinking, okay, where did we go wrong? What did we do wrong this time that it hasn't worked? And then starts the whole thing again. And imagine if you have to do this whole process, which could be from the moment, even if you only talk about one particular cycle of IVF, we could be talking about few months. If it is pretty straightforward, then we're talking about 2 months to 2.5 months. If we are looking at other complications that can happen, we are maybe looking at few months from the beginning to the end. Sorry, what happened to my screen? So, sorry. So that, that is the thing that I'm discussing particularly today, is the time scale of IVF. And also to think about that IVF now, as is seen by many, many, many people. I am the one who had IVF, so I am not against IVF. This is about realizing the possibilities of IVF. And also, when I do live again, I will be talking about how you can prepare a bit more, perhaps a little more yourself at any stage of IVF. Where can you fit in natural therapies, natural medicine, herbs, essential oils, mindset training, pranayama, and yoga? Where can you fit in this whole sequence of IVF? So I will be discussing that possibly on Sunday morning when I do live. So today it is just to highlight and this is not even, I mean, the time is kind of up. I've been talking about half an hour and still not covered anything much to do with this. I've given really, really simplistic scenario here. And I know that that is not the case. An average number of IVF cycles that couples are doing is between 3 and 5. They are generally given the package of 3 or 5 cycles from the IVF clinics as well. So the point here, I think the overall point of me discussing, as I started with, is integrating IVF and natural medicine. There is more possibility, there are more chances. Also, even if you do not end up being pregnant, the chances of damaging your health are less. Side effects of drugs will be less. And if you're working with a natural medicine mentor or practitioner like myself, then the chances of being a little, perhaps, there is more support there, and you feel as if you are not just on your own going through this whole process, not even once, but many times. And of course, I know and I've seen patients who have been through this journey multiple times, not 2 times, 3 times, 4 times, many more times than that. And that is a choice. Everybody has a right to make their own choice, whatever is suitable for you, however you want to choose to do this. The only point, and my point of highlighting this, is what can we do naturally at any step, whether you are going for natural conception or you want to conceive by IVF. What can nature do for you? What can natural medicine do for you? What can herbs do for you? So that's what I'm highlighting. And I hope it made a bit of sense regarding, and I'm able to highlight the practical things about the journey of IVF. It is probably one of the most stressful times for couples, one of the most stressful journeys that they can take in their lifetime. And the overall nature of the whole emotional stress and the chronic nature of it. And also, please remember, even when you do have the babies after that, 1 or 2 or many, you do not forget this emotional coastal ride that you were on. And also, during this ride, there are chances of miscarrying, there are chances of chemical pregnancies, much more, and the heartbreak and the stress of that as well is included in it. And it does not go away when you do become parents eventually. Okay, thank you for being with me and bearing with me, listening to me, and I hope it makes sense. Feel free to ask questions now or send in, separately a message. If you are a couple, if you are a woman who's going through issues to do with fertility and you don't know what else to do, maybe something else I can do, what else I can do, how can I prepare myself, perhaps natural medicine can help. So get in touch, and I will see you on the live again on Sunday morning. Thank you. Bye bye.